Welcome to Home Health 360, a podcast presented by AlayaCare. I'm your host, Jeff Howell, and this is the show about learning from the best in home health care from around the globe. Hi, folks, and thanks again for tuning into this episode of Home Health 360, where we speak with home health and home care leaders from across the globe. Today, I'm speaking with a healthcare expert with a broad background in program management, including extensive oversight of content development for events, websites, magazines, and social media targeted to professional healthcare audiences. I'm with Tim Craig, the VP and Chief Content Director for Lincoln Healthcare Leadership, the company that brings us Home Care 100 and has a number of other related brands like Long-Term Care 100 and Senior Living 100. Tim is also the managing director of the HI2 Conference, which stands for the Home Care Innovation and Investment Conference. Conferences are a vital part of making connections, learning from each other, and being a source of inspiration. And they are back. So today is all about home care and home health conferences. And Tim, I'm delighted to have you on the show.
Hey, Jeff, thanks for having me. I'm really glad to be here and looking forward to today's conversation.
So Lincoln Healthcare Leadership has a rich history of creating valuable networks and facilitating best practice sharing and delivering original business insights, really specifically for top-tier healthcare providers. How long has it been around, and what's it all about?
Yeah, well, so we started in 98, and I say we somewhat liberally because I was not around then, but David Ellis is the brainchild behind Lincoln Healthcare Leadership. And he started it with a single conference oriented around long-term care and very quickly branched into home care and then senior living. And then we've moved into some other areas, not least of which is investment in senior care services. And our sort of general positioning is quite simple. We are very much a top-to-top organization. So we bring the leaderships of various provider organizations in our respective sectors together with other leaders who are basically service companies to help them in their endeavors. And together they put their minds together for 3 or 4 days, typically in a retreat setting, very heavy emphasis on education. We're changing a little bit. So I know we're going to get into this in a little bit, but we're changing a little bit about kind of how we go about making those connections. But essentially, that's really if you call it the secret sauce. It has worked very well for us, and it's a high touch, high value experience. And if you've ever been to one of our events, you also know that we typically hold them in pretty nice locations. And then that's kind of the part of the promise is that you're going to get away from the office and really have the opportunity to dig in deep on the things that are going to move your 3 areas: strategy, leadership, and innovation. So that's kind of our pillar, and it has worked well for us, and we've established some really good roots in the areas that we serve.
So for the listeners following along, if you wanted to go to lincolnhc.com, that's LINCOLNHC.com. So Tim, I clicked on the 2022-2023 calendar. And so it looks like you guys have 5 brands and then an intelligence group. So let's go through these one at a time. We'll go in order on the website. Home Care 100. Not everyone knows about this. The first time that I came across it, it's really just the club of the top 100 home care and home health agencies in the United States. And I believe there's a revenue cutoff. I don't know if you have any other criteria, but it basically is you have to apply to come to the show. Can you tell us more about Home Care 100?
Sure. So going back to my comments earlier about starting in long-term care and then branching into home care, one of the things around the Home Care 100 conference and quite frankly, the Home Care 100 success is that we got in very early. If you can think about organizations right now for whom the greater world of home care is just appearing on their radar, and you think back to the fact that we started 20 years ago, I would attribute a lot of that to the vision of our president, David Ellis, who realized that slowly but surely care would migrate into the home, and we got in very early. are three core pillars of Home Care 100, because the word home care itself can be a little bit of a misnomer. Home care is used really in two ways in the industry at large. One, of course, is for personal care. So when you say it's a home care agency, typically it's a non-Medicare certified entity. It's more ADLs and companionship and what have you. But we use home care in a much broader sense. So home care writ large for the entire industry of in-home care services. And that would be certified home health, personal care, and hospice. And recently that's expanded. It's expanded and it's expanding. As we're having this conversation today, I think it's safe to say that what constitutes home care in the grand scheme now includes pre-hospice palliative care, in-home physician services, in-home behavioral health. These are all things that are slowly but surely gaining greater foothold within the Home Care 100 world. And so we serve a lot of different masters. For the most part, our cutoff, especially in the more developed areas like home health, has a threshold of $40 million and above in certain titles. So C-level executives, and then as larger organizations can bring more people, we have the ability to accommodate SVPs and VPs with the understanding that in some of those larger organizations, an SVP could actually have a fairly significant oversight for a large book of business that could be regional. And so, we sort of make exceptions there. But for the most part, it's a C-level conference for large organizations. And to your comment earlier, it really is represented by the top 100 quite well.
Right. So I'm on homecare100.com right now, and I can see that the next gathering is January 22nd to the 25th in 2023 at the Ritz-Carlton Orlando. One common theme I'm seeing here is that the getaways all seem to be in Florida and Arizona, maybe a few other states, but the hero shot on the website clearly shows me that this is going to be maybe a little vacation for me as well if I'm going.
Yeah, so that's a really interesting thing because there's a fine line between hosting an event at a very nice venue and hosting an event that plays out more like a boondoggle. And we're very, very, very careful to be certain that we stay true to our objectives of putting on a high quality event, and it sort of maintains a certain standard on a lot of different levels, education wise, and caliber of attendee, and even right down to the types of dinners and what have you that we host. We hold them at nice events for sure. In an ideal world, we would hold all of our events at 5-star. So that's the typical categorization for us. The irony, of course, is that, once you get to a larger conference, and Home Care 100 is becoming a larger conference, it's harder to find venues that can accommodate, the 500 plus people. So that's a little bit of a challenge for us, but with some good creativity, I'm sure we'll be able to make our way through.
I was also going to make the comment that the suppliers seem to be at that same level as well, because I would imagine there's a high bar for them to enter these conferences. And so for these larger organizations, they probably can beeline it a little bit faster to the suppliers that are a little bit more well-funded or just sort of have that natural seat at the table for these bigger companies.
Yeah, well, there's no doubt about the fact that at Home Care 100 in particular, not only do we attract the very top in terms of the provider community, but we also attract the very top in terms of the vendor community, Leacare being one of those organizations. And it makes for a really good sort of top-to-top gathering. So we value those relationships greatly.
Okay. So moving over to seniorliving100.com. Tell me a little bit more about this conference.
So senior living is a really important event for us. Senior Living 100, the way we define it, is mostly private pay senior housing. So that would be AL, IL, CCRCs, and memory care. And our somewhat unique distinction in the market is that we are very much agnostic when it comes to the ownership structure. So we have about half of our organizations are for-profit and half of the organizations are not for-profit. And, our philosophy is that those two worlds can and do learn from one another. And if, you sort of peel back the onion on that industry, you come to realize that there's a lot of bifurcation. Organizations either go for one or the other. And we have found a nice balance where we bring both together. The qualifications for Senior Living 100 are of a certain size threshold. So typically about 1,000 units and above. And so, if a typical AL/IL has about 100 units, it's about 10 and above. So not for the mom and pops and the one-offs, but definitely for the medium to large regional and of course national organizations.
And is the 1,000 units and above roughly the senior living equivalent to the 40 million in revenue for home care?
Yeah, that's about right. Yeah, that's a good way of looking at it.
Okay.
Our sweet spot, if you were to sort of look at an attendee roster, tends to be the more progressive, larger regional players, fewer of the national players, and there's a good reason for that. That world, if you know and you dig into senior living, you come to realize that there are organizations that are more operator centric, and then organizations that are a little bit more real estate centric. And we definitely fall into the categorization of more operator centric. Our ideal attendee at Senior Living 100 is sort of the operator's operator, innovative, high on programming, high on marketing, and sort of progressive, if you will, in the way in which they are growing and advancing their organizations.
So that's interesting. And then the large national players, it's almost like when Ray Kroc said McDonald's is in the real estate business, and that's their focus on their business.
And that isn't to say that the large ones aren't innovative. There are many that are, and they do really, really good things. It's just an interesting thing when you get to, it's almost equivalent to, we used to be in the health system space. And what we found is that we had absolutely no desire to define ourselves as the largest health systems, because the largest health systems were a completely different beast. The CEO of a $15 billion health system really doesn't have the bandwidth to sit down and sort of rub elbows with other CEOs. Or if they do, they really want to make sure that it's a very, very select set. And what we found, similar to what we find with senior living, is that our best constituent is the one that sees value in getting together with other like-minded, progressive C-level executives for a few days to share strategy. And that tends to be more in the mid-range than in the very high stratosphere for both senior living and for health systems.
Yep. Okay, that makes sense. So that's seniorliving100.com, and the next event looks like that leadership conference is in March of 2023. So now if I'm over at ltc100.com, is this the original?
This is it.
Okay.
This is it. So David Ellis, our president and founder, had worked in a media organization focused on long-term care, and branched off on his own in 1998 and bootstrapped together basically the beginnings of Lincoln Healthcare Leadership. At the time, it was just LTC 100, and it was significantly smaller than it is now. But now LTC 100 and probably Home Care 100 are as close as you can get to representative of our core model, which is what we call our 100s. It is for the skilled nursing facilities industry, nursing homes. It's evolved a little bit as the industry has evolved. So you have your typical SNF, but then you also have transitional care units. that tend to be entirely focused around short stay. But for the most part, that industry hasn't changed all that much. And I would say that that's both good and bad. It's actually one of the things that industry is struggling with right now is that it hasn't changed all that much, and it needs to. I'm sure it hasn't got lost on anyone who is listening to this podcast today that the last couple of years have not been all that kind to that industry. And so I think right now there's a very, very interesting phenomenon where organizations are trying to sort of pick themselves back up and figure out where do we go from here. Part of it is licking the wounds of the last couple of years and then taking a long, hard, deep look in the mirror and saying strategically, what do we want to be? What do we need to be? And does that require a reinvention? Does it require getting into home care, for example? That's a big, big topic that's going to be coming up amongst a lot of those organizations is, we have owned a higher acuity skilled service, albeit in a facility. Can we transfer some of those skills into a home setting, perhaps in support of something like hospital at home? Sure. And what does that look like? But C-level executives from large regional and national skilled nursing facilities, and we have a very good loyal following, and that's coming up in about a month or so, and we're looking forward to that one. That's a really, really good one for us.
Yeah, and certainly hospital at home has become a real big buzzword, but you're also starting to see SNF at home as something that people are looking into as well.
Yep, for sure. SNF at home is without a doubt sort of on everyone's radar. And it's funny because you could look at SNF at home from the lens of a home health operator, just like you could look at SNF at home from the lens of a skilled nursing facility. And, in one lens, it's more of an opportunity, in the other, more of a threat. But it definitely has and will have an impact on both.
Yeah, you're right. Okay, so I'm on htcexpo.com. So HTC stands for, what does it stand for here?
Home Care Tech.
Home Care Tech, all right.
So Home Care Tech is interesting for us because it's our newest. It's launching this year. And,
okay.
When you're in the home care world as much as we are, it never gets lost on you that technology it sort of finds its way into every conversation. And it can be technology from a sort of SaaS perspective, or it can be technology from a consumer perspective. I think it's safe to say that really our sweet spot is more of a B2B perspective, the technology that will enhance the delivery of care for a home care professional. And so when you sort of peel back the onion on that, clearly there are things that jump right out, telehealth for one, and remote patient monitoring. And then it kind of just splinters from there. There's all sorts of technology enhancements, from integrating Alexa into your care plan, to apps that facilitate wound management. So it's broad and it's wide, and it's exciting, and we're going after it in full force because we really believe that convergence of technology and home care it's like a symbiotic relationship. One feeds the other, and technology is going to be the thing that ultimately will put home care into a whole nother world in terms of its ability to serve a greater population seamlessly. And so we're excited about it.
Yeah, I love this idea because it's sort of like the IT person's dream to just go to one conference that's really focused on their persona, and companies sending and saying, "Hey, keep on top of all the latest developments in technology in one conference." And from a supplier standpoint, it's not sort of a mixed bag of personas that would be at a conference like this. It would be the people that want to stay on top of the latest technologies that are out there. So this is a really interesting theme to have for a home care show.
Yeah. And, it's funny because when you think about Home Care 100, you could look at Home Care 100 and say, we try to be all things to all people in one conference, but already we have our hands full with strategy, leadership, and innovation. And then you get into these questions around how do we integrate, data, and how do we integrate technology into a conference like that? And we run out of real estate. And so this is really exciting for us because now it gives us a whole new venue where we can say, let's really go deep, much deeper than one or two, random sessions. Let's build an entire conference around it. And that's what we're doing. And it's going to be an expo. So it's a hybrid between the model that we've known and done so well, which is more of a top to top strategic dialogue. This is also going to be every bit the show and tell that you would expect from an expo environment. But we also believe that there will be lots of opportunities to infuse some content that inspires a more strategic conversation.
Yeah. So let's end it here with your, I'm assuming, so you're the managing director for the HI2 conference, and it's just hi2conf.com. And the slogan is where home care deals happen. So, and it's coming up in Chicago in June. So tell us a little bit more about this.
Yeah, sure. So starting with the name, it's funny because it's hard to get the name HI squared to stick because it's hard to represent that, in a written form. But the HI2 is HI squared, and it's simply the innovation plus investment. This launched in 2019 as a slightly broader version of what it is today. So we had known for a long time that investment in healthcare services is heating up even before the pandemic, going back really until 2015, 2016. The amount of private equity money that was sitting around waiting for the sort of the dry powder phenomenon, waiting for the right opportunity was building. And then we really saw it take off, and we said, this is an area we need to get back into because we were in the investment in post-acute services with a conference that we hosted several years ago called HCAP. And we decided to get back in because we really felt the timing was right. And when we did that in 2019, the thing that quickly became obvious to us is that there is a relatively narrow band of hot areas that investors are looking to get into. And it just so happens, logically, because of what we know about what's happening in home care, that a lot of home-oriented services are where a lot of the activity is happening. And recently, we decided to take that narrowing and just take it to a whole nother level and make it all about home-oriented services. So essentially, what started in 2019 as a little bit broader around healthcare services in general, including things like dental and other areas where we know there are a lot of investment activity, has now been narrowed into essentially home health, personal care, hospice, palliative care, in-home physician services, in-home behavioral health. And then there's a couple of other areas that are also sort of on the periphery, DME, if you will. This is really going to be the place where home care buyers and home care sellers come together around a dialogue built on innovation, growth, and investment opportunities. And the reception thus far has been phenomenal. I can't really frame it any other way. We're very pleased with the way in which it's been received in the greater home care world. And we're in the middle of building the program right now, and it's just super exciting.
I can't think of another industry where the biggest player has less than 5% of the pie.
Yeah, exactly.
Usually you have a Coke and a Pepsi, and then you've got everyone else who fights for the last 20 or 30% market share. And the level of fragmentation in home care is, makes it so ripe for consolidation. And if you think about how young the industry actually is, right? Like Griswold is the oldest home care franchise, and they started in the 1980s. That wasn't very long ago.
Yeah, and it's funny. With that being said, it does feel as though there are a couple of deep pocket players that are slowly but surely emerging as forces in the industry. And I mean, it is what it is, but you look at Humana and their purchase of Kindred, and you say, okay, that I see that. That's, maybe up until now that was kind of a one-off. And then Optum comes along and acquires LHC, and that gets everyone's attention. I think that we're probably, we haven't yet seen what is going to probably be larger players staking a claim at the industry. And up until now, the world of home care has been sort of defined by a fairly simple concept of disparate but fairly traditional home health, personal care, and hospice players. And it doesn't take much imagination to understand that there are other forces that are probably going to start to really move aggressively, whether it's Walgreens and Village MD and what that looks like when it sort of coalesces and comes together in something that's a little bit easier to understand. But even health systems and sort of watching where hospital at home is going. What does that look like in 5 to 10 years from now? It's kind of fascinating. And so HI Squared, we believe, has the opportunity to bring together a lot of these different players, whether they're sort of traditional strategics in the form of, say, Amedisys buying Contessa, or someone else like, KKR or a large health system or a large payer that is making a big play into in-home care delivery.
Sure. And we saw Advocate Aurora buying Senior Helpers. Amazon has kind of quietly gotten into the business. Home Instead was acquired by Honor, that's right.
Yep.
And just yesterday, I saw Help at Home just acquired a couple of big agencies in New York as well. So I certainly think that I agree with you that this was pre-pandemic a trend. And then I would say that COVID has really accelerated the difference between the haves and the have-nots and really accelerated, private equity coming in, particularly in what you had mentioned about what's been happening with the SNF world over the last couple of years as well.
Jeff, the other thing that I might say is that, we're up until now, the conversation around HI Squared has been sort of who's buying whom and who's getting larger and where's consolidation happening to a certain degree. I think the other piece around what's happening in home care is fascinating because kind of behind the scenes, you're seeing a pretty big shift. And I think that's where things are really interesting to see how acuity is going to play out. So if you were to say right now and ask maybe 5 different entities who they thought was going to win out in hospital at home, you'd probably get 5 very different answers. I know that there are some traditional home health organizations that hope and think it's going to be them. And I'm sure there are some health systems that hope and think it's going to be them. And I think there's some private equity that hopes and thinks it's going to be them, and go down the line, insurers, what have you. I guess my point is the whole world of higher acuity in the home is still very much an undefined future as to who's going to own that space. And I think a lot of the dialogue that happens at a Home Care 100 or at a HI Squared or at our Home Care Intelligence Group, or perhaps even at Home Care Tech, is the degree to which some of the organizations that have traditionally been in the home can reinvent themselves as much higher acuity capable entities. And can they rightfully stake that claim for that piece of the business, or whatever other piece of the business, whether it's chronic care management or what have you, comes down the road. Because in reality, that's not how they were structured, right? In reality, Medicare certified home health organizations were not meant to provide longitudinal care. It was get in and get out. So when you say earlier that we're kind of still in our infancy, I'd say that, yeah, we really are in our infancy in that regard as to who's going to be able to put together that comprehensive longitudinal care model that's going to be able to keep eyes on the patients all the time, that's going to serve a population health construct, that's going to be able to take risk and work well with managed Medicare Advantage. It's fascinating to watch it all play out, and I think there's lots of players that are going to emerge over the course of the next couple of years as significant forces to fulfill that vision.
Yeah. What ways do you think that home health has been both set back and vaulted forward due to the last 2 years?
Well, the setback is sort of the low-hanging fruit. It's sort of the obvious piece, and I know we're probably all a little tired of hearing about it, but it's certainly not going away, and that is staffing. And there's not a day or a week that goes by that you don't talk to someone and they say, were it not for staffing issues, we'd be growing at a much higher clip, and so that's definitely an impediment for the immediate term. As to where that goes in the next couple of years, I guess is the thing that on a lot of people's minds to understand, both on a micro level, but then what could potentially happen on sort of a more macro level in terms of legislation and things that could help ease the staffing pressures. But in terms of where things are going, I mean, when you look at, so you said the word home health, but I'll maybe answer it through the lens of personal care. I think it's really fascinating to see what has happened in the last couple of years when skilled nursing facilities and assisted living facilities were facing tremendous pressure to the point where, not only did adult children not want to place their parents in those facilities, but in many respects they were taking them out of those facilities. And then they asked themselves, what is my option? What is my alternative? And there was a little bit of a coming of age of the personal care business, because people came to realize, wow, I could have someone come into my home and do those services. And I guess I'm not even sure I knew that existed before. And we heard anecdotally through a lot of people, whether it's, Right at Home or Home Instead or any organization, that was happening at a very frequent basis, where people would come to them and say, that's something I didn't even know existed. And so I guess one question is, how much of that does that continue going forward? And then also in the last couple of years, there's just been a couple of things that have happened that are maybe unpredictable. I mean, all of a sudden, CMS is rolling out, an acute care in the home model, and now there's a real hospital at home, not just sort of a one-off at Mount Sinai or Johns Hopkins, but there's dozens and dozens of them. And, where does that go, and what does it look like, and how does it evolve over the next few years? I think if you were to ask a lot of people who are very well versed on the whole concept of acute care in the home, you'd probably get a lot of very, very different answers about the future of hospital at home and higher acuity care in the home. Some are very bullish and say it's great and it's going to be great for home health and it's going to really take off. And then others maybe throw a little bit of cold water on that and say, I'm not so sure. It's an unproven model. And oh, by the way, it's really hard to do. And I think there's another piece in the equation, which is you need for there to be sort of a lever higher up in the food chain for it to all work. It's predicated on health systems wanting and needing to discharge, lower acuity care so that they can fill their beds with higher acuity care. And I see that. And on paper, that certainly makes a lot of sense. But it has to happen in fairly large volume for it to be really sustainable. And so I guess it'll be interesting to see, in what pockets of the country is that going to happen, and we're going to probably watch it very carefully to see how that plays out, and who owns it, and what does it mean for home health. And back to your question, I guess the one thing that is on a lot of people's minds, and it's been on people's minds in this industry for a long time, and it will continue to be, is how do I get to own a little bit more of the care coordination and not be commoditized? And so if you just look at hospital at home as sort of a bellwether for the degree to which home health avoids becoming commoditized, I think it's really interesting case study. Will there be partnerships where home health kind of owns part of it? I think that's why Amedisys' acquisition of Contessa is really exciting and fun to watch, because they want to own it. They don't want to be, the downstream player.
Yeah, all things in the home for Amedisys will go through Contessa. Yeah,
exactly.
Yeah, and I have to think that the Buurtzorg model has to be incorporated into a hospital at home model where you can't have doctors driving around all day, right? The whole value of them being in a hospital is that they're accessible at all times, and and in any emergencies, you see the doctors running down the hallway. And so the idea of having your entire care team basically live in your neighborhood, that's where I think that you could marry the two elements of people wanting to age in the home and us wanting to keep people out of expensive hospitals, out of buildings, but at the same time being able to deliver high value care. And so these doctors literally have to be physically in close proximity to all the patients as well.
Well, you just brought up something that is, makes me think of another potential impediment to a lot of this advancing as quickly as we would hope it would. And that is, you have a lot of innovators, progressive innovators, medically home being one of them, and dispatch and what have you. And they all have a vision, and they all see where things are going. And I think we all agree with them. But there are some fairly large levers that need to be pulled. And historically, CMS hasn't pulled those as quickly as we'd like to see them. And so I think that remains to be a really big question is, is there going to be enough greasing of the wheels to allow for some of these more progressive, value-oriented models to advance? There was a time, I think we all remember, back in 2014, 15, 16, where the drumbeat from CMMI was about value-based care and innovation and what have you, and then it cooled down quite a bit. And I think that's a big question mark. And certainly one of the questions I'm going to be asking Seema Verma at HI Squared is, when do we get that drumbeat moving back again toward more value-oriented care? And even things like, bundled payments, where there was an opportunity for, a post-acute provider to own a bigger share of the savings. It seems like that is still kind of missing. And I think a lot of people are hoping and waiting that those levers are going to be pulled to allow organizations to sort of capture a little bit more of the value creation that they're delivering.
I think the latest number that I saw was something like about 1 out of every 3 home health agencies are not tracking outcomes, right? And so that's probably disproportionate to the smaller companies, but I think it's also indicative of, even speaking with health systems, and I asked them, what are you doing for clinical reporting, and how are you trying to, predict what's going to happen and not just report on what has happened? And most organizations are still trying to keep their head above water, right? And all of this is paramount for us to move to a value-based pay world.
Well, so what you just said right there is often comes up in the context of a conversation around the speed at which consolidation is going to happen. And you often hear people say, sure, consolidation is going to happen very quickly because there are organizations just taking PDGM, for example, who just can't keep up, right? They can't keep up. And so they're going to be gobbled up, and there's going to be a lot more consolidation. I think that your comment earlier about very few owning anything more than sort of a small percentage would suggest that it's going to be a long time before there's so much consolidation that it looks like other industries. It's still going to be very disparate. But on the PDGM level, on the ability to negotiate contracts with Medicare Advantage level, a lot of those smaller guys are probably not going to have the wherewithal to really make it on their own in kind of the new world order, if you will.
Well, speaking of adapting, March of 2 years ago hits, not a particularly great time to be in the conference business, especially high-end conferences, especially for an audience that's very health conscious. What's been the last 2 years for you guys? How have you guys adapted? I know you've got these intelligence groups, and you guys are more than just a premium, group of conferences to go to. So bring us through, COVID hits, and how have you guys adapted, and what does, your sort of like this hybrid world look like for you guys now?
Yeah, that's great. Well, I would say one thing, and that is, in real estate, they say everything is location, location, location. In our world, I guess everything is timing, timing, timing. And we had the good fortune of having had two of our conferences in 2020, not least of which was Home Care 100, which is one of our larger conferences, and that served us very well. And that, I don't know if cushion is the right word, but it gave us a little bit of breathing room to say, okay, we now need to take a very long, hard, deep look in the mirror and decide, what does the next 6, 9, 12 months look like? I do remember conversations. I'm sure everyone has these memories where we thought we'd be back up and running by the latest, by the summer of 2020.
My boss said, "Hey, I'll see you in 2 weeks."
Yeah. So we thought it was going to be relatively short-lived, and it turns out, I just had this conversation with someone the other day, and it turns out that it was almost exactly 2 years, right? So that's all in hindsight, but it is interesting to see how long did it last. I think we can all say that it's kind of winding down. But in terms of what it meant for us is there was an insatiable appetite to understand what this means for the provider community. And we decided to lean into that challenge. And for the first 6 months, it was quite literally like drinking from the fire hose, because we were putting together, and then you can just sort of fill in the blanks, webinars, podcasts, CEO roundtable calls on a very regular basis across all of our segments to provide information about what was happening. Very often that was in the form of immediate, emergent, COVID-related information. I can honestly say I'm very glad that those days are over, because I felt as though I had become sort of a COVID expert, and not that it was a bad thing to learn, but that really wasn't kind of where our heads had been at up until that point. But we had calls with epidemiologists on a weekly basis, and we were doing all of these think tanks. And you take that and you combine it with where we saw things going, sort of indefinitely. How long is this going to last? And is there now an appetite for more digital content? And that was a little bit of the genesis of the intelligence group. The backstory to the intelligence group, though, is that for a long time, we had wanted to do something much more frequent than a once-a-year conference. And in fact, we got something off the ground several years ago that we called the Lincoln Intelligence Group, that was designed specifically for that. But there probably wasn't as much of a need or demand at the time. People were much less versed in sort of Zoom calls and what have you. But we had that in our DNA, that desire to want to bring together more frequent connections with our constituents. And so you take that background and then the reality in front of us, and that was what led to the beginnings of the what is the Home Care Intelligence Group and the Lincoln Intelligence Group. And it's really turned into something very rich for us that is all about connections and content. And it's kind of like a light consulting business in many regards because it is a membership model. So they tend to be very active and there are fewer of them. And so we try to provide as much value as we can in terms of bringing them the right content and helping them make the right connections. And then the piece that is the most exciting for us is, all of the time and energy that you spend, sort of becoming an expert, if you will, on a specific topic. You can now deliver that in a slightly different way in the form of maybe a presentation to a board or something along those lines.
And so for the intelligence group, as a membership, do I still would have to meet similar criteria as the shows you put on, the conferences?
Yeah, it's similar. It's not quite as restrictive, but the pool from which we pull are the executives from the organizations that attend our conferences. So I think there are very few organizations that come from outside that. And that's by design, because a lot of the times when you're bringing people together on a roundtable call, it's really important that you have like-minded organizations. It would not make sense to bring Beata onto a call with a very, very small organization. They're looking at the world through a different perspective.
Yeah, it's the same crowd regardless of what either conference or intelligence group it's right across the brand. It's the exact same audience for sure.
Yep.
Okay, Tim, well, we're bumping up against our time here, so I'll get you out of here on this last question. What are your thoughts on the future of conferences?
Well, it's been very gratifying for us to see the bounce back. You used the phrase earlier, conferences are back. And I think it's safe to say that they are. We didn't get into this earlier, but we did actually fulfill some in-person events in the end of 2020 and the beginning of 2021. I can tell you that was a very interesting experience on so many different levels. Testing and masking and social distancing and going through all of the different iterations of those who did or did not want that to be in place at an event that they were at. And we saw all stripes and all colors and all permutations. But it also gave us the perspective of, are people ready? And I can say that at the end of 2020, they weren't. And in the beginning of 2021, I think maybe they thought they were, but then maybe it kind of got bad again. Now it feels very different. Right now it feels very different. People are ready to turn the page, and it feels good to be back. But I do think that there's a couple of caveats that come with that. I think that maybe they're going to be a little bit more selective. So if they can get some of their content through digital means, maybe they now say, I used to go to 5 events, I'm going to go to 3. Or if I'm really interested in one topic, like maybe the thing that drew me to a conference in the past was they had a session around PDGM or Reach ACO. Maybe I don't need to go to the conference for that. Maybe I can just go to a webinar and get my dose. But I will say that it's very hard to replicate in-person networking. And we know, not only through our numbers of attendees, but also anecdotally, that is one of the things that people have liked very much about us slowly but surely putting the pandemic behind us and being able to get back in person. And so we have every expectation that the shadow or the shroud of COVID will have a significantly less of an impact on people's desires to get together. And so now the ball is back in our court to do what we feel that we do best, which is to make it attractive enough on a lot of different levels, including content, so that they say, when I'm choosing the 3 versus the 5, that one of them will be ours.
Sure. And I think as humans, we have a powerful propensity to want to keep things normal. And everyone has a couple years of pent up desire to not only live a normal life, but actually have gratitude as to, how great normal can actually be.
Well, I'll tell you one quick little anecdote. We score everything. I mean, as you can imagine, metrics are a big part of what we do. So we want feedback and we want to hear what people have to say. And we were patting ourselves on the back for the first couple of conferences that we did, the end of last year and the beginning of this year, because the scores were so great. And then we quickly came to the realization that part of the reason the scores were so great is just there's this natural jubilation to get back out of the office and back with other people.
Hugs and handshakes.
Yeah. Well, we quickly realized that part of it was us, but part of it was just the sheer ability to put the Zoom behind and get back in person. And we're trying to ride that momentum and hopefully it'll stick around for a while.
Well, Tim, it's been a pleasure meeting you virtually. I hope to meet you in person one day. Hopefully we can have a drink at the next Home Care 100 conference or wherever they let me out of the house to go to. Maybe I'll see you at the HI Squared. So I
would like that.
Thanks for coming by today and keep up the great work.
Thank you. Nice meeting you.
Home Health 360 is presented by AlayaCare. First off, I want to thank our amazing guests and listeners. To get more episodes, you can go to alayacare.com/Home Health 360. That's spelled Home Health 360, or search Home Health 360 on any of your favorite podcasting platforms. The easiest way to stay up to date on our new shows is to subscribe on Apple Podcasts, Spotify, or wherever you get your podcasts. We also have a newsletter you can sign up for on alayacare.com/Home Health 360 to get alerts for new shows and more valuable content from AlayaCare right into your inbox. Thanks for listening, and we'll see you next time.